Greetings. I'm Hugh Hewitt. Thank you for listening this morning. Hour number 3 is now underway, and I'm pleased to report the best news of the morning comes from the Institute for Health Metrics and Evaluation at the University of Washington School of Medicine, grading the need for ICU beds, the number of ventilators, the expected death toll. The United States is doing its job. Joining me to discuss that, United States Senator Marsha Blackburn from the great state of Tennessee. Senator, good morning. Great to have you on the program.
Good morning. It's good to be with you.
Last week we added 92.9 up in the Tri-City area, including Bristol and Johnson City, and we're glad to have more Tennesseans listening.
Well, indeed we are, and I think right now what we're seeing, Hugh, is so many people are looking for actual information, things that are factual. They're tired of a lot of the opinion that is being given by many many newscasters. And so what they're saying is, give me the facts.
The facts, as reported by IHME today, is the death forecast is still very high, 81,766, with a range of between 49,000 and 136,000. That is down significantly from their range of last week, Senator Blackburn, which was 100 to 240,000. If we keep depressing the curve, that number will continue to fall.
That is exactly right, and it is a matter of individuals continuing to follow the CDC guidance, wash their hands, practice their social distancing, make certain that when they go out, they are covering their face. I wear a mask and I wear gloves every time I go out, and I think those are important things for people to do.
Now, Senator, talk to me a little bit about Phase 4. I wrote a column about Leader McConnell for the Washington Post this weekend. I think you are blessed to have in the country as one of the greatest leaders the Senate has ever seen. But Nancy Pelosi wants a Phase 4. The leader said last week on this show he wants to see how Phase 3 works. What does Marsha Blackburn think?
One of the things that we are beginning to talk about for the next round of activity, and some of my colleagues in the Senate and I are working on this, is to say, okay, how do we, number one, craft an exit strategy from this? And number two, how do we have something that is basically a kick the hell out of China approach? And that involves bringing our pharmaceutical manufacturing back. And, of course, I have my legislation that would incentivize bringing that back. And that legislation's been around for a while. And Senator Menendez is the lead Democrat sponsor on that. Also, looking at expanding broadband into rural areas so we can bring other types of manufacturing and technological manufacturing back and utilize those technologies. And I think you're going to see us do this. I told one of my colleagues last week we should call this the Momma Act, Make America Manufacture Again, and bring these jobs back to U.S. shores, because we've become so dependent on China in different supply chains, whether you're looking at the pharmaceutical component or you're looking at automobile aftermarket auto parts or automobile manufacturing parts, or if you're looking at different components for technology, high tech, there's a certain battery component that is used in amplification equipment. The single source for that is now China. So there is a variety of things where we have outsourced this. And you look, we all know it, China steals our intellectual property. They go in and they reverse engineer our products. They have lied, they've cheated, they've been stealing from us for decades. So now is the time to say, okay, we're never going to put ourselves in this situation again where we are completely dependent on a country for an item, like our antibiotics.
Now, Senator, I agree with you 100%. I think you and Tom Cotton, Mike Gallagher, Senator Menendez bring pharmaceuticals home. But I must say, in the $2.2 trillion Phase 3, there was almost nothing for the Department of Defense. And China is our strategic adversary. And if there is a phase four, I think the Republicans will have failed unless it forward appropriates critical infrastructure for our triad and other weapon systems that deter China.
And as we look at the NDAA, the National Defense Authorization Act, we are taking in so many of these considerations. And Senator Inhofe is leading a lot of that work, Hugh. And as we continue to work through that process for this year, you're going to see much of that embodied in that legislation as we look at them. A couple of years ago, I said I felt like the new axis of evil was North Korea, Iran, China, and Russia. And I had someone remind me of that comment recently because you look at the alliances that are there. You look at the way China withholding this information has hurt us. And they knew they had this. I was talking to some activists last week. They knew for 51 days they had an outbreak on their hands, but they didn't want to mess up the Chinese New Year and the festivities with the Communist Party leadership coming to Wuhan for part of that celebration. So
I agree. But, Senator, if I want to go back to something. I trust Senator Inhofe on the NDAA completely, but if there is a phase four, there has got to be forward appropriation for strategic systems. There wasn't anything in the $2.2 trillion for example, Columbia-class submarines or B-21 bombers. I am shocked, actually. I'm told it was OMB's unilateral decision to tell the Senate we didn't want anything. But you have to lead the gang in making sure that the forward appropriation of these strategic systems that face down China, because we can have all the pharmaceutical manufacturing in the world, but if we don't deter the People's Liberation Army Navy at sea, it ain't going to help us much.
Well, and you're right about that. And that is never far from my mind, the fact that we have to stay on top of that as a big part of our game. And you're exactly right on that. I think that it is vitally important that we look at this. You know, we've talked about a whole of government approach.
Yes.
As we look at an exit strategy and as we look at a way forward, you're exactly right, Hugh, because the $2.2 trillion, and that was really a rescue package. And that was a way to soft land the economy because the federal government was saying to businesses, you have to shut your doors. And that was health, food, and financial rescue. Now it is time for us to move to recovery. And in that recovery and in that way forward, we have to take into account what is going to happen with our defense systems and looking at the bad actions and looking at China's desire. Their goal is complete domination, and we have to realize that. And
now I want to close, Senator, on a high note.
Sure.
I think Dolly Parton is a constituent of yours, is she not?
Indeed she is.
She has been the most remarkable purveyor of good humor, goodwill, and good acts. I don't know if she's already got the American Medal of Freedom, but she needs one because she's amazing. I just get sent to me by people all over the country. This is what Dolly Parton did today. I had no idea she was this public-minded.
She has always been public-minded. Dolly is very dear. And when you look at what she did for Upper East Tennessee, up in Sevier County, where she grew up there in East Tennessee, it is amazing. The establishment of Dollywood, the jobs that has brought, the way she has worked with education and giving every child who is born in this state, they get a book a month for the first year of their life. And Dolly has done that for years. She's probably done that for 20 years. And just to be sure these children have books and have the ability to read regardless of where they live and what their income level is.
Well, your colleague Lamar Alexander told me Alex Haley's tomb has on it, find the good and praise it. Well, let's find
That's
Dolly
right.
Parton and praise her because she deserves
I totally
it.
agree with you. Yes, she does.
Senator Marsha Blackburn, keep coming back from the volunteer state. Thank you, Senator. I'll be right back, America. Don't go anywhere. You're listening to the Hugh Hewitt Show, except perhaps over to YouTube.